Hi, I'm Tatiana Falcon, a child psychiatrist here at Cleveland Clinic Epilepsy Center. Welcome to a series of webinars targeting educational topics for parents of children with epilepsy. We assemble a great team of doctors, psychologists, nurses, social workers, parents, patients with epilepsy, and epilepsy educators to help you navigate all the different challenges that epilepsy may present. Project Care for Epilepsy is designed to improve care coordination, increase social support, provide education, and increase engagement for teens with epilepsy and their families. This project is supported by the Health Resources Services Administration of the U.S. Department of Health and Human Services. The information, content, and conclusions presented here are those of the authors and are not the official position or policy of HRSA, Health and Human Services, or the U.S. government. At the end of each webinar, there will be a link to answer 4 questions about the new topic you just learned about. Please take a moment to answer this quick survey. It will help us understand your needs better. The Cleveland Clinic Epilepsy Center welcomes and thank you for your participation in this educational series.
Hello, I am Dr. Elia Pestana Knight. I am a pediatric epileptologist at the Cleveland Clinic Epilepsy Center. Today, I am going to be talking to you about anti-epileptic seizures and rescue medications. Specifically, the topics that we are going to cover today are: what are anti-epileptic drugs? The historical development of the drugs, how doctors select the drugs to treat the seizures, what are the common side effects to expect, some considerations to treat special populations with these medications, what are the common drugs interactions, and what are the seizure rescue medications that we have available today. Let's start with what are anti-epileptic drugs. Anti-epileptic drugs, anticonvulsant medications, and anti-seizure medications are interchangeable terms that are used to describe the medications that we have today to treat seizures. But they are not exactly the same. Anti-seizure medications are medications that decrease the frequency and/or severity of seizures in people with epilepsy. They treat the symptom of seizure, not the underlying epileptic condition. These medications do not change the course of the disease. Anti-epileptic drugs, on the other hand, prevent the development of recurrent seizures in people at risk. They reduce the seizure frequency and severity, outlasting the treatment period. For example, after a head trauma, a stroke, or a brain tumor, they will prevent that more seizures will occur over time. Unfortunately, we don't have a lot of this type of drugs in the market. Animal studies suggest that levetiracetam and ethosuximide are medications who have potential anti-epileptic drug effect. But there are no studies in humans to support that. There is also some evidence that the ketogenic diet is in this category. Nevertheless, we use the term anti-epileptic drug to refer to the medications that we use today to treat epilepsy. But in reality, these medications are anti-seizure medications. The anti-seizure medications, they are not exclusive to treat epilepsy. Some of them are used to treat pain, migraine, and some psychiatric disorders such as bipolar disorder, mood disorder, and anxiety. How are seizures generated? Well, the brain function by a balance of two main mechanisms. There are others, but it is a balance of excitation and inhibition. Seizures are produced when there is too much excitation or too little inhibition. So the treatment of seizures is targeted to this main mechanism. Most of the drugs that we have today are dedicated to increase the inhibitory mechanism. How anti-seizure medications work? Well, they suppress the rapid and excessive firing of the abnormal neurons during the seizures. And they also prevent the spread of seizures within the brain. This also means they try to contain the seizure within the area of the focus. Let's look now at the historical development of the drugs. As you can see, between 1857 and 1978, there was a limited number of drugs, and there were many years between the initial drug bromines developed until valproate, the last drug of that generation, came to the market. And I have to tell you, despite many advances, bromide is still used in many parts of the world as a drug to treat refractory epilepsy and to treat a specific type of epilepsy known as Dravet syndrome. It was not until the 90s that we have a new wave of new anti-epileptic drugs development in the United States. These generations of drugs is known as the new anti-epileptic drugs. Some of these drugs, such as vigabatrin, have been available since the 90s and only reapproved in the United States since 2009 because of the unusual side effect. Clobazam also have been used in the world for a long time and only recently approved in the United States. This group of drugs haven't received a name per se as a generation. Maybe their name should be the newer anti-epileptic drugs. There are other treatments, diets, and devices that can be used for anti-epileptic treatment as well. One example is the sex hormone progesterone, particularly for women who experience catamenial epilepsy. Some diets or modification of diets, such as the ketogenic diet, the low glycemic diet, the modified Atkins diets, are very useful to treat epilepsy. Some devices like the vagus nerve stimulator and the neuropace have proven to be useful as well. And of course, the epilepsy surgery for cases who have focal epilepsy. How doctors select the drugs to treat the seizures? The goals of the treatments are three. The first one is to reduce the number of seizures, to cause the minimal adverse events or side effects, and to provide the best quality of life possible. To select the anti-epileptic drugs and be able to accomplish these three goals, doctors have to keep in mind the seizure types or epileptic syndromes, the age of the patient, to decide whether the medication needs to be administered in an oral suspension, in a chewable tablet, or in a sprinkle formulation for children, or is a pill for somebody an adult that can swallow pills without difficulties. The dosing schedule, if the medication needs to be administered once a day, this is good for teenagers, or it has to be administered 2 or 3 times a day. A dosing that needs to be administered 3 times a day is more complicated for somebody who works or somebody who is in a school who needs to get the medication administered at school. Then you have an extra caregiver who needs to agree and remember to give the medication. So adherence is an issue that needs to be taken into account when selecting the antiepileptic drug. Comorbidities and other medical conditions also need to be considered. For instance, if you have somebody who has epilepsy and migraines, you could pick a medication that could treat both conditions at the same time and minimize the number of medications that the patient will be taking. We also need to consider the potential side effects and toxicity. For instance, if the woman is pregnant, you don't want to give her a medication for seizures that has potential side effect on the fetus. And of course, we need to consider the interaction with other drugs. So let's talk a little bit about what are the common side effects. So there are three major categories of side effects associated to the antiepileptic drugs. The first category is acute side effects or side effects that are related to the dose that the patient is taking. These side effects are typically reversible. The second category is idiosyncratic side effects. This is rare. We are glad that this is the case because these side effects are typically serious or life-threatening. And the last category are chronic side effects. These side effects not always are reversible, and the seriousness of these side effects is variable. Let's take a look at the common acute or dose-related side effects. The most common are in the neuropsychiatric area. Frequently, patients can complain of sedation and fatigue, particularly at the beginning of the treatment. We can see this with all antiepileptic drugs. There are some antiepileptic drugs that cause less these side effects. Among them, we have the lamotrigine and the felbamate. Another common side effect is unsteadiness, poor coordination, dizziness or vertigo. Mainly, this side effect is seen with the first generation of antiepileptic drugs. This could be a sign of toxicity or too high dose with many antiepileptic drugs. Tremor is another of these side effects that is commonly seen if the patient is taking valproate or valproic acid. Another side effect that can be encountered is paresthesia or tingling in the extremities. This is typically seen in patients taking topiramate or zonisamide. Some patients complain of double vision or blurred vision or visual distortion, particularly when taking carbamazepine or lamotrigine. Mental or motor slowing or motor impairment can be reported in patients that are taking high dose of topiramate. Mood or behavioral changes can be seen in patients taking levetiracetam. Some patients, particularly adults, report change in libido or sexual function if they are taking all drugs such as carbamazepine, phenytoin, or phenobarbital. Gastrointestinal side effects are also seen. Common ones are nausea or heartburn. Sometimes these side effects can be ameliorated by adding antacids or proton pump inhibitors. Some of these medications can cause mild to moderate laboratory changes, like low sodium. This is the case of carbamazepine or of carbazepine. This could be serious because low sodium can cause seizures. Sometimes we can see increased liver enzymes or low white blood cell count or low platelets. There are some medications that can cause weight gain and change in appetite, particularly increased appetite. The most common one is the valproic acid or valproate. Also, the gabapentin and the pregabalin are in this category. But some medications can cause weight loss. This is the case of the topiramate that also now have been FDA approved with another drug for weight loss in some patients. the zonisamide and the felbamate also cause weight loss. Let's now look at the category of idiosyncratic adverse side effects. These are rare, but they are very serious. And here we have the toxic epidermal necrolysis and the Stevens-Johnson syndrome. The most common drugs that can cause this are the lamictal or lamotrigine in patients who are also taking valproate, or in particularly we see this when the treatment is aggressively titrated, meaning the dose escalation is too fast. The signs that can be seen in patients who are developing Stevens-Johnson syndrome are evidence of hepatic damage. Early symptoms include abdominal pain, vomiting, jaundice or yellowish discoloration of the skin and mucus, changes in the laboratory, but sometimes they cannot be helpful because they cannot be detected early enough. So the most important thing is patient education and awareness about this serious syndrome. Fever is a common symptom, and the rash that appears in the mucous membranes is also very important, because this rash appears in the junction of the mucous membranes with the skin, particularly around the mouth and around the eyes. There are some hematological damage that can happen as an idiosyncratic reaction: bone marrow aplasia, agranulocytosis, aplastic anemia. All these symptoms have been described with felbamate. The early symptoms can include abnormal bleeding, acute onset of fever, symptoms of anemia such as shortness of breath with trivial exercising. Lab monitoring is not helpful in early detection. The most important drug causing these symptoms is felbamate, so blood monitoring is recommended weekly. Patient education is again the most important way to prevent or early detect this rare manifestation. There are some chronic side effects, and as you can see in this slide, they span different symptoms. In the endocrine and metabolic system, we can see bone disease, osteomalacia, and osteoporosis caused mainly by the old drugs. Therefore, patients should have vitamin D supplementation. The deficiency on folate can cause anemia, but also can cause fetal malformation. So it's very important to supplement with folate women who are in reproductive age and is taking any of these drugs listed here: phenobarbital, phenytoin, carbamazepine, or valproate. Changes in the connective tissue causing facial coarsening, hirsutismo, which means excessive facial hair, gingival hyperplasia, which means excessive mucosal growth around the teeth, and link contractions can be seen with phenytoin and phenobarbital. In the neurological system, we can see neuropathy or cerebellar syndrome causing poor coordination with phenytoin. Sexual dysfunction is reported in 30 to 60% of the patients taking all generation drugs such as phenytoin, carbamazepine, phenobarbital, and primidone. There is an antiepileptic drug hypersensitivity syndrome that is characterized by rash and systemic involved. It's typically caused by phenytoin, carbamazepine, phenobarbital, or carbazepine, and if the rash develops with any one of these drugs, be aware that it can be a cross-reactivity to any of the 4 drugs listed here, and a relative cross-reactivity to lamictal. So discuss with your doctor if you're having a rash to any of these drugs, and sometimes it will be wise to go with a drug that is not listed in this slide. What should we consider in special populations when we are selecting antiepileptic drugs? Well, first in the children. What about the neonates? Often the dosing is lower per kilogram because these patients have low protein binding in their body and they have less ability to metabolize their medication. Therefore, they need less amount of medication for their body weight. The opposite happened with older children. They have excellent liver and kidneys, therefore, they metabolize medication faster, so they need higher doses of medications and doses that are more frequent. How about teenagers? Well, for females, we should avoid medications with potential for teratogenesis. This means damage to the fetus if there is an unplanned pregnancy. Also, some antiepileptic drugs reduce the efficacy of oral contraceptives. So we should always recommend that some other contraceptive methods should be considered in addition to the oral contraceptive to avoid pregnancy in teenagers. And some drugs should have undesirable physical effects, such as valproate. Valproate can cause weight gain, acne, excessive facial hair, and some connective tissue changes which could be undesirable for a young teenager. For both gender, we should consider that many of the antiepileptic drugs have a black label for depression and suicidal ideation. Therefore, screening for depression is very important when we are prescribing antiepileptic drugs for teenagers. What about pregnancy? Well, pregnancy also causes important metabolic changes in the body, such as changing the amount of fluid in the body. This is what increased volume of distribution means. There is also relative less amount of serum albumin. This is what lower serum albumin means, and faster metabolism. Therefore, we need to administer higher doses of medication to pregnant women. So in this patient, it's very important that we do serum levels of drugs and also that we measure the free levels of the medication when this is available. It's important to administer more frequent dosing to pregnant women when we are doing the dosing of medications in these patients. And we also need to remember that once the pregnancy is over, we rapidly, within the next 2 weeks, we need to change the dosing to pre-pregnancy dosage to avoid toxicity. We also need to keep in mind that some of the antiepileptic drugs have teratogenic effect. And we also have to keep into account that there are metabolic changes that occur in certain conditions with some antiepileptic drugs. One common example is during febrile illness. During febrile illness, there is an increase of the metabolic rate or the ability of the body to metabolize the antiepileptic drugs. Therefore, the serum concentration of the medication goes down. That's why it's common that children have seizures when they have febrile illness. There is also increase in the amount of seroprotein that can bind to antiepileptic drugs. Therefore, the free levels of the medication decrease. So this explains some of the things that we see during the febrile illness. There are different ways to deal with this. You can use short-acting benzodiazepines to avoid seizures during this period, or you can temporarily increase or give extra doses of antiepileptic drugs during this period. If the patient has severe hepatic metabolism, many of the antiepileptic drugs are metabolized in the liver. You should also keep this into account and adjust the dosing of the medication accordingly. If there is renal disease, some of the antiepileptic drugs are eliminated via the kidneys, so therefore the amount of medication that needs to be administered in this patient is less than the one needed for a person of similar age or the one recommended for the weight of the patient, if this is the case of the child. Similar is the case if the patient has chronic renal disease and it is in dialysis. You should administer smaller doses and give it more frequency. And also the time of the dosing should be following the dialysis. What about drug interactions? Well, it's important to keep into consideration the pharmacokinetic interaction between drugs. We need to consider drug interactions in some specific situations. The first one is when there is an addition of a new medication, when you are taking a medication that can change the liver metabolism of other medications. When there is the addition of another medication that can change the liver metabolism of other medications to an existing medication regimen. Or when there is a removal of a medication that can change the liver metabolism of other medications from chronic medication regimen. So in summary, whenever you add a medication with liver metabolism or you remove a medication that affects the liver metabolism, you should consider that they may be a drug interaction. The drugs interactions are relevant for all antiepileptic drugs such as phenytoin. The phenytoin can cause inhibition, and this can affect other antiepileptic drugs such as valproate and topiramate, and some other medications that are not antiepileptic drugs like ticlopidine, used in patients who are prone to stroke, or fluoxetine fluconazole, used as an antifungal medication. The carbamazepine can also interact with antifungal, antibiotics, and anti-arrhythmic medications and cause inhibition of these medications. The lamictal can cause inhibition of the valproate. And it's important to know that there is some interactions with oral contraceptive. Oral contraceptive decrease, the efficacy of this medication is decreased by inducers, including phenytoin, phenobarbital, primidone, carbamazepine, and in higher dose of topiramate and oscarbazepine. Therefore, you should warn women in reproductive age that are taking oral contraceptive that they could get pregnant if they don't add any other method of anti-contraception to their plan and they rely exclusively in the oral contraceptive. There are some drugs, antiepileptic drugs, that do not appear to be either inducers or inhibitors, and they are safe to take. And these are gabapentin, lamotrigine, pregabalin, tiagabine, levetiracetam, and zonisamide. So if you are encounter a patient who is taking multiple medication for multiple chronic conditions, you should select a medication from this list. There are some foods that has effect also in the metabolism on the medication, and one of them is the grapefruit juice. A patient should avoid drinking or eating grapefruit if they are taking particular any of the all antiepileptic medications. Last, let's talk a little bit about rescue medications. Rescue medications are medicine for the acute treatment of seizures. They can be given intravenously, this is in the hospital, or for the use of the paramedics, or they can be given transmucosal, and this is what we use at home. And what are the medications that we have available today for the transmucosal use? Well, the most common of those is the rectal diazepam, and this medication is administered rectally. The indication is for convulsions or grand mal seizures lasting more than 3 minutes or cluster of seizures. The treatment of rescue medication is typically individualized depending on the severity of this convulsion in children, so your patient should have a seizure action plan. My preference for older children or teenagers is to use the buccal midazolam or the intranasal midazolam or lorazepam. The take-home points today is that the anti-seizure medications are prescribed taking into account a number of factors. Always disclose to your physician what other medications or supplements are you taking, as this can cause drug interactions. And that seizure rescue plan is very important for all people with epilepsy. It has been a pleasure talking to you today. I am Elia Pestana Knight. If you have a question about anti-seizure medication and rescue medication, you can contact us at the Epilepsy Center in the Cleveland Clinic. Thank you for your attention.